It's Melissa, and we're back talking about hip popping. So here's some exercises for you to kind of help with that hip popping. It's really going to focus on certain muscles that we want to train and some of those technique issues that we talked about. This particular exercise I'm going to start with is actually from the progressive ballet technique, and it's a way to work on your passe and working on that hip staying down. So you want to take a small ball, get it between your ankles, and you're going to start with your foot flexed. Here's that deep bend in the hip socket. So you're going to point your foot, roll up, really focusing on the deep bend, and the hip is not moving. It's harder to move your hip if you're laying on your side. So really focus on that deep bend in the socket, and you want to get to a full pointed foot. And then you're going to roll the foot back down. Same thing, really focusing on that deep bend in the hip socket. And then you're going to flex the foot. If you're really having a lot of issues with the hip popping, you're probably not going to be able to be here. You're going to have to turn it in a little bit and go where you're not happy about it, but get rid of the pop while you do it. And then as you get better and stronger, you can rotate up a little bit. If you're really struggling with it, make sure you check out our turnout video, because it will also give you some hits on how to get better turnout with a strength issue. So the second one we're going to do is a clam, which probably a lot of you have done. But you gotta make sure you're using the right muscle. So one of the issues that dancers have is we overuse this small muscle at the top, which is called your TFL for short. It's your tensor fasciculata. And this muscle overworks, and you wanna use your rotators, which are more in the back and in your derriere, coming from the side of the hip and going into the pelvis. So the easiest way to kind of get a sense of that is to use your hand. You're gonna put your hand here, and now what you want to do is just to get a sense is to just turn out the leg. If you feel this muscle, you can even see mine here, pop up into your hand, you're using the wrong one. So you want to, it's easier to start here and then work on squeezing the heels together, and that's going to kick your rotators in. So you're going to squeeze the heel together, lift the knee just a little bit, focusing on the derriere, squeezing in the back, and then lowering it down. Once you can do that without feeling anything in your hands, then you can start to go a little bit higher, and you can do a full clam. So you can pull up, so mine kicks in right about there. This is my bad hip. And then you're gonna lower it down. So you gotta kind of really work on this. This exercise is very brain oriented, so you're not gonna rip this out right before class. You kind of have to go where you can really think about it. The second one that overworks is when you're lifting your leg up to the front. So it's sort of the same idea. You want to get something slippery underneath your foot. For this purpose, I'm going to use a pillowcase because this is vinyl and I got a bare foot. But if you're in your bed, take a plastic bag, put it over your foot, and then that way it'll slide really easily on your sheets. So you just want to get here. You're going to do this on both feet, by the way. Make sure that you get your back nice and straight. You don't have to slam it down this way. You just want to make sure you're not in a super arch. Just really simple, keep yourself tight through here. And now same thing, place your hands here. The easy part is to slide it down about halfway. The hard part is to bring it up without getting this pinch here. So you really gotta feel that it's deep in the socket, that deep bend in the socket, and then slide back up, trying to not get this muscle to do it, but more deeper in the socket through here. So again, very brain oriented, very picky, and it's very hard to do, but it will help retrain so you don't have so much of that hip lifting when you're doing your ballet technique. All right, so now we're gonna go standing. Okay, so we're gonna do donkey kicks. Very simple glute exercise. Believe it or not, dancers tend to be very, very weak in their glutes. So you're just gonna come, you wanna lean on a table, on your bed, something along those lines. Get yourself unlocked on the standing leg. This knee is going to come forwards into the table, feeling that your back stays straight where it is. And now you're going to keep your back where it is, and you're going to bring your leg up toward the ceiling. Don't drop. So you're going to come here. Again, find your deep bend in the socket, and then lift up through here. If that gets pretty easy for you, you can put a weight on your foot, or you can put some TheraBand on a loop on the floor and stick your foot in it and work a TheraBand that way. The last one, which is a whole lot of fun, is what we call airplane. Airplane is getting yourself in a parallel arabesque. I shouldn't even say arabesque. It's just parallel to the floor. So you got to get yourself tipped all the way forwards. Again, not an arabesque, all the way forwards. This hip is square to the floor, and I'm in a T this way. You're going to keep yourself in that horizontal position. Bend your knees, trying to bring your hands to your floor because you bend, not because you drop. So horizontal to the floor, and then stretch back up. Don't move anything. Down to the floor, stretch back up. That one will really work your back chain to kind of help with some of those issues with the hip popping. So hope those are helpful for you. And then next week we're going to talk about some do's and don'ts to do with stretching and also things at home.